Now, here's our reporter, Laura Windsor, with more on robotic hysterectomy.
If a woman has a gynecologic condition that merits removal of her uterus, the robotic approach to hysterectomy could be the alternative method to consider. We went to Pomona Valley Hospital Medical Center and spoke to Dr. Dhaliwal about this new surgical system.
The women come in complaining of heavy menstrual cycles, pain during their menstrual cycles, bloating sensation, cramping sensations during their menstrual cycles. Oftentimes it can be just a sensation of pain, heaviness, back pain, bloating, or just not feeling normal during their menstrual cycles, and that usually leads to the workup and the evaluation necessary for a hysterectomy. More often than not, these women suffer from fibroids, which are benign tumors that are found in the uterus, and approximately 1 in 3 women will have fibroids, with the African American population being more prevalent. It can be familial, so if your mother required a hysterectomy at a younger age or an older sister required a hysterectomy, there are chances that you too can require a hysterectomy at a younger age.
What conditions would necessitate a hysterectomy?
Once a woman presents to the office complaining of these symptoms, oftentimes we will go through a range of treatment options for them, which would include medications or surgeries. Medications would include anything from hormonal management, like the birth control pill, or medications to alleviate some of the heaviness of the bleeding. Surgery can include options from what's called a dilatation and curettage, an endometrial ablation, which is where we actually burn the lining of the uterus, and that minimizes the bleeding that they have in the future. We could also consider doing a procedure called a myomectomy, which is where we remove just the fibroid from the uterus and not the entire uterus. The myomectomy procedures are usually done in the younger population for women who still want to maintain their ability to have children.
Dr. Dhaliwal talks about the surgical options and the benefits of the robotic hysterectomy using the Da Vinci surgical system.
Once a patient decides that she does want to proceed with hysterectomy, there are several different methods that we can do it. We can do it abdominally, which is the traditional method. We can do it vaginally, we can do it laparoscopically, or we can do it with aid of the Da Vinci surgical system. The benefit to the physician, we can definitely operate with more skill, more accuracy, and improve the surgical technique that's performed. We can minimize our bleeding. We can do these surgeries with 1/3 less bleeding than we can with the traditional route. All of these methods that are beneficial to the surgeon translate to benefits to the patient as well. With the minimally invasive surgery, the patients can be discharged the same day from the hospital. Oftentimes they need to just stay 1 day in the hospital, whereas with traditional surgeries, they ended up staying almost 2 to 3 days in the hospital. Their level of pain is extremely low. Most of them just require Motrin or ibuprofen to help with their pain. Very few of them require any kind of narcotics, so the amount of medication side effects that the patients experience is less. Also, within 2 weeks, most patients feel completely back to normal. They're limited in a few things, such as heavy lifting and heavy exercising for up to 6 weeks, but more often than not, they can go back to about 90% of their normal activities after 2 weeks. This surgery is extremely successful. The change in the approach to the operation, the change in the approach to the patient has been completely transformed. So it's an incredible benefit to the patients. Once they do have the surgery performed, they do feel a renewed sense of energy, renewed sense of purpose in their life.
As with any surgery, ask your doctor about all the treatment options as well as their risks and benefits. For the American Health Journal, I'm Laura Windsor.